To prepare for the AdVance male sling procedure, the patient is placed in dorsal lithotomy position, with legs bent at 90 degrees, and slightly spread no further than shoulder width apart. The procedure begins with a low midline perineal incision through the skin and subcutaneous tissues. Next, the bulbospongiosus muscle is opened along the midline and reflected laterally to expose the corpus spongiosum. To allow mobilization of the bulb, dissect laterally between the muscle and the corpus spongiosum. Identify the central tendon by lifting the proximal bulb anteriorly. Mark the origin of the central tendon on the bulb. Gradually incise the fibrous portion of the central tendon, pausing frequently to check for bulb mobility, until a 2 to 4 centimeter proximal displacement can be achieved. The AdVance helical needle passer will be inserted into the obturator foramen, about 1 finger breadth below the adductor longus tendon, just lateral to the ischial pubic ramus. To identify the proper insertion site, palpate the inferior pubic ramus and feel for the bony landmarks. Make a small stab incision at each needle entry point. The first step in sling placement is to insert the AdVance needle passer. To insert, hold the needle passer at a 45-degree angle. Place a finger of the opposite hand into the perineal incision to receive the needle and protect the urethra. Insert the needle tip straight through the obturator foramen. After 2 pops are felt, stop advancing the needle and drop the needle handle toward the midline to align the needle path. Rotate the needle until the tip meets your finger, and bring the needle tip high into the perineal incision. After passing the needle, connect the sling by pressing the white connector onto the needle tip until it clicks into place. Make sure the sutures are facing away from the urethra. Once connected, pull the sling out the stab incision by rotating the needle back along the insertion pathway. Pull only enough to bring the center of the sling to the patient's midline. Cut the sheath and mesh below the blue mark on the end portion of the plastic sheath. The needle passage and sling connection are now repeated on the patient's contralateral side. Before suturing the sling to the bulb, position the center of the sling flat against the corpus spongiosum with the edge of the proximal flap at the previously marked point. Tack the center portion of the sling to the corpus spongiosum proximally and distally using resorbable suture. The suture should pass through the mesh at least 2 pores from the edge of the sling to ensure sufficient fixation. The sling is then pulled tight to reposition the urethra. There will be approximately 2 to 4 centimeters proximal movement of the urethra. The motion is parallel to the posterior urethra, repositioning the urethral lumen rather than obstructing it. Flexible cystoscopy is recommended at this time to confirm proper sling positioning, as shown here. Once correct positioning is achieved, remove the plastic sheaths from the sling and confirm sling tension. The procedure is completed by closing the bulbospongiosus muscle, the rest of the perineal incision, and the stab incisions.